Why do physicians and others who work in healthcare recommend that patients create advance directives? One of the fundamental principles of medical ethics is that of patient autonomy, which means that the patient has the right to make their own decisions about their health care. And we talk about that through a process called shared decision making. What that means is that a physician or other healthcare worker will explain to you your treatment options, their risks, and their benefits, and armed with that information, you then decide what path you wish to pursue. Unfortunately, for all of us, at some point we are likely to lose capacity to make medical decisions, whether that is something like a car accident that rendered you unable to speak temporarily, or a more chronic illness such as a dementia or complication of a surgical procedure. In those situations, we would like guidance regarding who to talk to that will make medical decisions for you that you feel are in most agreement with your desires in that situation. Well, why do you need to do that? I hear that question quite frequently. Many times patients tell me, oh, I have a power of attorney. But in fact, the financial power of attorney that allows someone to complete your banking or make other financial decisions for you does not extend to them the right to make healthcare decisions. Likewise, there are a lot of assumptions about who in your family or the friend at your bedside will be allowed to make decisions when you're in the hospital. In fact, if you have not designated a healthcare power of attorney, then the legal system designates a hierarchy that we have to follow. Some of it is logical, but other situations it may not reflect what you think. For example, the state of North Carolina does not recognize common law marriage, and if you have not divorced your spouse, then technically your spouse is still your default decision maker in situations where decisions must be made. In addition, another example, your children. If your children are the default decision makers, then the majority of your adult children must agree before any decision can be made. So designating a specific healthcare power of attorney takes some of that conflict and uncertainty away and directs us to the person that you feel would be most likely to respect your wishes. After we talk about a healthcare power of attorney, we then talk about a living will. Now, a living will is designed to give guidance to your healthcare team and your healthcare power of attorney regarding specific situations. Most commonly, living wills include statements of your desires regarding things like life support, CPR, feeding tubes, and intravenous antibiotics. But some living wills do extend to other healthcare procedures. It is important to note, however, that a healthcare power of attorney is not obligated to follow the wishes expressed on your living will unless you have checked the box on the living will that states that they do not have the right to override your living will. So what happens after you create these documents? Yes, it's easy to do the legal side of things, but more importantly, first of all, you need to have a conversation and ongoing conversations with your extended family, but also with that healthcare power of attorney, so that they understand your values in particular situations, why you want those decisions to be made, and so that they can be comfortable that they are respecting your wishes. Also, periodic reevaluation is important. Your desires may change as you age, as you develop other health problems. Your wishes about things like life support may change. Your healthcare power of attorney may also need to change. Unfortunately, sometimes your designated healthcare power of attorney may get sick before you do, or they may develop other problems or perhaps be transferred out of the area and not be immediately available. So having a conversation and periodically reevaluating these documents are as important, if not more important, than the actual creation of them.